Hi, everyone. Thank you for joining Debbie Stream Foundation's Health Equity webinar series. Today's webinar will feature Aisha McDonald. Her presentation will be about addressing the gaps and barriers to healthcare. Thank you to our generous sponsors for making today's program possible. Platinum sponsor Estella's and Friends of Debbie Stream Foundation, Merck, and Tito's Vodka. First, I will share information about stomach cancer and Debbie Stream Foundation. Then we will hear a presentation on health equity, on addressing the barriers of healthcare with Aisha McDonald. Stomach cancer is the 5th most common type of cancer and the 3rd leading cause of cancer deaths globally. In 2025, approximately 30,300 Americans will be diagnosed with stomach cancer, and nearly 11,000 will lose their lives to the disease. The overall 5-year relative survival rate is 36%, dropping to at least 7% for stage 4, highlighting the urgent need for increased awareness and research. Stomach cancer also disproportionately affects minority populations, with Native American, Black, Asian, Pacific Islander, and Hispanic communities experiencing significantly higher mortality rates compared to white populations. Debbie's Dream Foundation is dedicated to raising awareness, advancing funding for stomach cancer research, and providing education and support internationally to patients, families, and caregivers. Our ultimate goal is to make the cure for stomach cancer a reality. You can learn more by visiting our website at debbiestream.org. Pictured here is Debbie Zellman, founder of Debbie's Dream Foundation. Debbie was diagnosed with stage 4 stomach cancer in April of 2008. She had no risk factors and only vague symptoms. At the time, she was told that her chance of being alive in 5 years was only 4%. Debbie founded DDF in April of 2009 and dedicated herself to helping others with stomach cancer by raising awareness and providing resources and education. Simultaneously, she endured harsh chemo regimens and targeted treatments and experienced many recurrences. Unfortunately, Debbie passed away on December 23rd, 2017 at the age of 50 after a 9.5-year battle with cancer. As an organization, DDF continues her important work and legacy. In a few short years, DDF has achieved many great milestones. Our mission ambassadors provide outreach throughout the country. Our PrEP program helps patients, their families, and caregivers match with survivors and caregiver mentors using disease-specific criteria, including stage, biomarker, and location. We host educational webinars and symposia year-round, and our website contains in-depth information about stomach cancer. We have also provided more than $2 million in research grants to date. Patient advocates come together each year at our annual Stomach Cancer Capitol Hill Advocacy Day to secure funding from the Department of Defense's peer-reviewed research program, the PRCRP, which allows funds for stomach cancer research. Earlier this year, in February, we traveled to DC with nearly 200 advocates to inform them that we need more funding for this deadly disease. We are proud to say that this year was our largest turnout yet, and despite significant budget cuts, stomach cancer remains on the PRCRP budget thanks to our efforts. We hope that you'll join us next year and let Congress know that we need a cure. There are 2 ways you can ask questions during this presentation. The first way is through chat. To access the chat feature, the chat icon is at the top of your screen. You can type your questions or make comments into the chat section throughout the presentation. We will address your questions and comments as we can. In addition to the chat feature, you can also enter your questions in the Q&A box. It will look like a quote box with a question mark on the inside. Your questions will be addressed either during the presentation or at the end of the presentation. So please join me in welcoming Aisha McDonald, a licensed mental health counselor, certified trauma expert, and nationally recognized trainer and advocate. Aisha has dedicated her career to serving marginalized communities across South Florida, including individuals with severe mental illness, co-occurring disorders in youth in the welfare system. As Director of Training Initiatives, she leads the Mental Health First Aid Crisis Intervention Team programs, having trained over 3,000 individuals in crisis response mental health awareness. As a passionate diversity, equity, and inclusion and belonging consultant, Aisha works to dismantle systematic barriers through professional development, community education, and creative content. Her lived experience as a Black immigrant Caribbean woman informs her powerful advocacy for culturally responsive care, including her work on the documentary Faded Conversations, bringing Black mental health to the forefront. Whether it's facilitating barbershop dialogues, performing slam poetry, or shaping DEI strategy, Aisha brings the heart and insight and action to every space she enters. So with that, I will pause and allow Aisha to begin her presentation. Let me stop sharing my screen.
Thank you so much for that introduction. I always forget about some of the things I do until I hear somebody else talking about them. So I was listening to you while going, oh, wow, that's neat.
Incredible.
So,
And you now have the presenter access.
thank you so much. I will go ahead and share my screen. And I'm just going to jump right into the topic so that we can be mindful of time. Today, we're talking about how to just better understand some of the barriers to healthcare that may be present. On behalf of Debbie's Dream Foundation, I am always grateful for anyone who tunes in to the subject matter that are being presented on whichever topic that interests them. So thank you to anyone who is watching right now, because we are always, always, always grateful when people are willing to learn more about the work that Debbie's Dream does, as well as how to better understand how we can make sure that the right care is being provided to people in an appropriate way. And so, one of the things to start off with talking about is always, what does access to healthcare even look like? And access to healthcare can have such a profound effect on people's overall health, because we know that when individuals do not have adequate access, that can oftentimes result in higher morbidity and mortality rates. And so, what we hope the health systems look at and really confront is, what are some of the barriers to patients being able to receive quality and equitable care for when they need it for whatever reason. And so, some of the key barriers to healthcare that we have seen in the health systems is, there's a shortage. There aren't enough people all the time. There's definitely, I know as a licensed mental health counselor, we are currently dealing with staff shortages at so many of our community behavioral health agencies, and we hear this time and time again. If there aren't enough people to be able to do the work, then we're not able to get to as many people as we need to. There's also transportation access. How are people able to get to where they're going in time for the appointments that have been made? And then lack of health insurance is a significant factor in creating barriers to people accessing care. And we see that for a lot of individuals who may not have employee sponsored insurance, they may be more reliant on government insurances. And when losing that, that then limits their ability to access the healthcare that they need, as well as financial constraints. Taking care of our health is expensive. Whether it's seeing specialists, whether it's buying nutritious foods, whether it's just going to the doctor and being able to afford the copay or private pay costs. And so, looking at the financial constraints that people have been dealing with definitely impacts their ability to access quality care. And then, of course, there's language barriers. We know that in so many parts of our country, there's large parts of the population where English is not their only language or primary language. And so just being able to communicate with the healthcare professionals can present a barrier for those who may not be fluent in certain languages or may not have the comprehension skills to understand what is being told of them. I know personally, I've been before doctors, and as somebody who isn't English speaker, a native English speaker, there's been times where even just the professional jargon that's being thrown out at me isn't always easy to comprehend and grasp. And so just being able to understand and comprehend the language that is being spoken by the providers is an important aspect of accessing care. One of the other things that has been looked at systemically has been, what do the social determinants of health look like as it is impacting individuals' ability to access care? And social conditions are how we live and how we learn and how we grow and how we work. It looks at a few different facets, such as what does their access to quality education look like? What is their, again, access to healthcare, and what quality of healthcare are people receiving? What about the neighborhoods? Where do people live? Where are people growing? Where are people learning? And what is the built environment around them? Is there accessible resources within that community, or do they have to come out of those community to access those resources? Are they living in communities that are highly populated and densely populated? Are they living in communities that are more prone to pollution or trauma or violence or any other types of issues that can have a significant impact on people's lives and health? And then what about the social and community context of those neighborhoods that they live in? And then, of course, the economic stability. We talked about financial constraints on the previous slide, but that will definitely have an impact on people's day to day lives depending on their level of socioeconomics and where they fall. And so, thinking of those social determinants of health is really important for us to really look at what the quality of life outcomes and potential risk might be for individuals who are being impacted by different healthcare issues. And so, some of the examples when we look at social determinants of health that may come up for people, and that may also have an impact on their well-being, on their quality of life, on their day-to-day functioning, can look like, are they living in neighborhoods that are safe and stable? Do they have transportation? What do those neighborhood environments look like? Are they facing racism, discrimination, neighborhood violence, systemic violence? Do they have access to not just quality education, but also job opportunities? Are they able to have stable income to be able to afford their day to day needs? And then what does the access to nutritious foods and physical activity look like in the environments that people are growing in? With their high impact of pollution in their air, in their water? And then what are the language and literacy skills that people have in their abilities to be able to ask for the help that they need or access the resources that are going to be detrimental to impacting their lives? One of the things to address as we process the barriers to healthcare is not just the social determinants of health and things that are impacting them systemically, but also the impact of those interpersonal relationships that they have with the health systems they come in contact with. And we know that there are certain stigmatizing concepts that sometimes may be present in healthcare system that presents further barriers for people to get proper diagnoses and treatment, as well as having successful outcomes. There's health condition related stigma that may be related to living with certain diseases or having certain health conditions, or they may just be stigma based on people's identities and personal traits. And so this stigma is a barrier to care for people that may be seeking out services, whether for disease prevention, whether because of treatment for the conditions that they're living with, or even in the ways that they're able to get support to maintain a healthy quality of life. And addressing that stigma is so important so that we can really understand where people are coming from, what exactly are they dealing with, and what are the negative stereotypes that are sometimes overgeneralized about individuals or their conditions that individuals are now dealing with as they go through healthcare systems to be able to get the help that they need for different conditions. And addressing that stigma is so important because as we look at how people believe they have been treated, individuals that have felt stigmatized are less likely to come back for help. They are less likely to seek services. They are less likely to use the resources if they believe that they have been treated in ways that leaves them with negative and adverse reactions. And so part of the barriers to the access to healthcare that some individuals may present with is also their mistrust. And this may be personal mistrust, or it may be community mistrust, or just mistrust based on lived experiences or the history that individuals have learned about. And so there has been significant mistrust in the medical research and healthcare systems that can oftentimes lead to worse outcomes for patients because of these feelings of mistrust that they may have about the system as a whole or about individual one on one professionals. For groups of people who may have gone through historic marginalization or oppression because of their race and ethnicity, a lot of this mistrust is based on the history of experiences that have caused them to feel discriminated against. And so researchers have studied this mistrust of the healthcare system and have seen where a lot of the racial and ethnic bias that may have presented itself by the professionals and providers can oftentimes emerge into becoming institutional biases. And when those systems are in place, it does present continued barriers for people to access care. Because if I don't fully trust the provider that is there to help me, to support me, to treat me, I'm going to be less likely to want to go back to that individual to get the help that I need. If I don't trust the system of care on a whole, I am not going to go to that system of care when the time comes where I need that help. And so the continued mistrust in the medical system, in the research field, in healthcare, is definitely impactful for so many individuals for so many reasons. I'm going to pause because I want to make sure I'm not missing any questions in case there are any. And so just checking in with Jen, are there any questions? Are there any comments? Are there any thoughts?
No comments have or questions have come through yet.
Okay, perfect. Thank you. I just want to make sure that we're addressing anything as it comes up. So, to continue the conversation as it pertains to the healthcare system and what that looks like, there's different reasons for mistrust. And different people have relayed different just self reports and life experiences as to what has led for them to be mistrustful of the healthcare system. There's some individuals that have felt that their symptoms were discounted, that providers did not listen to them when they spoke about what they were going through, that they may have dealt with experiences where individuals were culturally insensitive to their needs, to their beliefs, to their thoughts, to their feelings. Some individuals may have been provided with inaccurate information that didn't really match up with what they felt they were going through. And then there's some who just did not feel as if the providers appropriately engaged with them or even cared for them. And this definitely can impact that client patient relationship as well as making the person feel comfortable enough to really connect with their providers in ways that is going to be beneficial to their care. Another reason for the mistrust that have been reported is just feeling a lack of cultural competency or cultural sensitivity or even cultural awareness. And this is understanding that we are oftentimes treating people that come from different perspectives, different backgrounds, different cultures, different lifestyles than our own. And we may not ever truly be fully competent of somebody else's culture. However, there is a level of cultural sensitivity that can make somebody feel comfortable in being able to interact and engage with the treatment provider. However, when that's not there, that can definitely lead to individuals feeling as if they were not heard or listened to appropriately, or that they were not understood from a cultural perspective. And then when they leave feeling misunderstood, they're less likely to want to continue to be engaged. Another potential reason for mistrust is having increased access to information. We have technology at our fingertips in so many ways. And for a lot of individuals, when they have questions that they need answers to, as it relates to their health conditions, individuals are more likely to seek out answers through Google, through searching the internet, through what they determine are their own means of research. And when this is the route they take and they're not getting answers to their questions from the providers, or the answers are vague or don't offer much clarification, they're more likely to start believing what it is that they found rather than the vague responses that they've been given. And that increased access to information can make people lead to assumptions about their health conditions that may not be the full picture, but they are quick to jump to these assumptions and believe in these assumptions because they may not feel that they've been provided with enough information from the treatment providers themselves. And so this may cause people to feel as if, well, you see, they didn't even tell me what was wrong with me. And so I had to go look it up myself. I can't trust them to really keep me informed the way that I want to be informed. And then there's imperfections, and this is with any industry. Of course, that none of the industry or institutions or systems of care are ever entirely perfect. But for a lot of individuals, they may encounter these imperfections so frequently that that causes them to lose their faith in the systems that are really there to help them. And so the reasons for the mistrust can really become exasperated in them having just these negative experiences over and over and over again that then makes them overgeneralize and consider that this is a um, just illustration of the whole system instead of just a fault of the few. And then, of course, we spoke about insurance and financial constraints before, but insurance can present a really huge barrier when it comes to the mistrust in the system, especially if there are necessity issues that then just are not approved or not assisted with or offer no supports. And that lack of trust in healthcare can also lead to lack of trust in insurance companies as well, in being able to realize and achieve the proper care that they need because of the barriers that may be presented.
We did have some a question and a comment come through regarding mistrust.
Oh,
The
absolutely.
first was, how do you deal with mistrust with clients when it's truly valid?
That's a hard one. And I will say, as a clinician myself, um, I have oftentimes tried my best to make sure I validate them, and let them know that, I really do understand where you're coming from. If it is a personal interaction that has caused this mistrust, I try to figure out what I can do to amend that. What can I do to really repair and build back that relationship that has really caused this mistrust? Is it something that I have said? Is it a manner in which I dealt with this person? Is it something that I did not do enough of? And really try to listen to their perspective, regardless of what I think I did right. If when it's a mistrust in the system, I validate that entirely because it's real and true for them, whether or not it's been my personal experience as well. Um, One of the things that I've had clients tell me is about prior experiences that they've had with previous clinicians that have been just negative interactions that have just left these really bad tastes in people's mouths that makes them not want to have future interactions. And by the time they come to me, they've already built up those experiences in such a way that it caused them to really consider that the entire system is like this. And I tell them the same thing that I say about any field. There's some people in every field that are going to suck. There's some mechanics that you take your vehicle to, And it doesn't matter how many times you've given them your vehicle, you always come away still having an issue because they're bad mechanics. There's bad doctors, there's bad therapists, there's bad lawyers, there's people who are in the field that are just bad illustrations of the field on a whole. They aren't the best at their job, and these representations, unfortunately, may cast a bad light on all of us. But I do validate that sometimes you have had these negative interactions that have caused you to deal with that. But what can we do in the present moment to move forward in a way that is going to be to your best benefits? And I try to listen to them and come from a perspective. Now, if it's things that go entirely outside of protocol, I do explain to them like the limitations in what I can do in a practical sense. But there is a lot of relationship building and repair that needs to be done to address mistrust so that we can move forward in a way that is beneficial for the patient's or the client's needs. So thank you.
Yeah, that was really informative.
Thank
And
you.
someone had made a comment to this issue as well. Anger management is an issue. I've been talking this talk for years. When I was younger, there was just no question, just despair.
That is definitely a good point. I think the more mistrustful we get of the system, the more angry we get at the system too, especially when it's time and time and time again that you have been trying to address an issue and it just has not worked out to your benefit. Um, I can share, like, personally, I had an issue with going to specialists where and again, the increased access to information. I was having certain symptomology that was so bothersome to me, it was causing an intense distress in my life. And at the time, the specialist that I was seeing, due to lack of insurance and financial constraints, were all a certain demographic. They were all male specialists. And every time I went to one of them and I explained the pain that I was in, the symptoms that I was feeling, what was coming up for me, it was being discredited. It was being discounted. They weren't really listening to me. At one point, one of them told me, he was like, "Oh, that's just something all women go through." And I was like, I promise you, like, I have female friends and we talk to each other, and this is not normal. And at that time, I went online and started researching because I felt so unheard in these types of medical settings. And I fully, like, came away with like printed sheets of my symptoms that indicated a certain diagnosis, and it was disregarded. One person told me that's why he hates patients going on WebMD, and I was like, well, the reason I've gone on WebMD is because I've been making these complaints for years and nobody will listen to me. And eventually, I changed facilities and I found a different doctor who was a female at the time. And I remember sitting in my first appointment with her and going, listen, I know it's not that serious, but I'm still feeling these. And I laid out the symptoms for her. And her response was like, no, that's actually not normal. We need to run some tests on you. And I said, wait, what now? And she's like, yeah, that doesn't sound good. And you sound like you're in a lot of pain. And I remember feeling my anger just dissipate. I was like, wait a minute. Here was somebody who took time to listen to me. Here was somebody who validated all these years, like for so many years, everything that I had been trying to say. Hey, I don't feel like this is normal. And she went, yeah, I don't think it's normal either. Let's get you some further help. Um, and eventually was able to give me a diagnosis, and then present me with a treatment plan as to how we were going to address it. And her presenting me with the plan was definitely from a perspective of collaboration. Hey, this is what I think is best, but I want to make sure that you are in agreement with it because this is your body and this is what you need. And I want to make sure it fits your needs. And it was such a different perspective, to be able to release that feeling of anger and mistrust and distress that I had been dealing with for so long. And so it's so important that when we are encountering this mistrust, figuring out how we can personally work to really address it in a way that allows for more collaborative care. So I really do appreciate the question and the comments. Anything else for right now?
No, no,
Okay,
no, we're good for right now.
thank you. One of the things that we need to consider as providers is what our personal biases look like. Because sometimes things come up in how we interact with different groups that are so implicit, or that it happens from a subconscious level without us intentionally trying to do so, right? And we've seen studies have shown that even with the same insurance, even with the same socioeconomic status, a lot of individuals that come from historically oppressed groups have received a lower quality of care. And when we look at what are these negative explicit and implicit biases that may be held against different individuals from racial and ethnic minorities, from individuals with disabilities, from individuals that have gender or sexual minority groups, looking at those biases and personal thoughts that we've held on to is important, because that system of personal biases can have long lasting and devastating effects on healthcare, as well as can impact systemic and institutionalized policies that are made. And so addressing the bias in the medical field is important so that we can make sure that everyone is receiving equitable care in a manner that is best fitting for their needs. And so, looking at racial disparities and inequities in the healthcare system, studies have shown that it affects so many aspects of care, of treatment, of diagnoses, and even health outcomes. And this has caused increased morbidity and mortality issues for individuals in the way of cancer screening or treatment. Earlier, you mentioned the impacts of diagnoses of stomach cancer on different groups, with Black and Brown individuals having higher rate risk of late diagnosis. Looking at Parkinson's disease and dementia and other neurological issues, the type of end of life care individuals get, looking at the treatment people receive for cardiovascular disease or pain management. What does the care for people with HIV look like, as well as neonatal and maternal care and mental health treatments? And so addressing these racial disparities is imperative so that we can create equitable, quality care for everyone. And so, some of the importance of making sure that we're addressing, and based on your screen, this might be a little bit small, so I'll read them. But disparities in healthcare can have significant implications on professionals, administrators, policymakers, and even the consumers of all different backgrounds. And so, this also can pose moral and ethical dilemma that can be challenging in our health systems today. And so these decisions that are being made based on these disparities of more resources given to some rather than others can result in unequal distribution of healthcare access across different population groups. And so health professionals, as well as the policymakers who are the decision makers in our systems, must also be cognizant of the importance of healthcare resource that is tied to social justice, opportunity, and quality of life for people. And from a public health standpoint, when there's racial and ethnic disparities, this threatens the efforts to improve our overall health as a nation. And so when we look at Black and Brown communities who are experiencing poor overall health status and lower levels of access to health care, this causes a disproportionate burden on Black and Brown communities of having more chronic and infectious illnesses. And when they have this higher burden of disease and mortality among minority groups, this has a profound implication for all Americans that can result in a less healthy nation with higher costs for health and rehabilitative care. And so it's important for us to address these so we can minimize the impact of healthcare conditions on our country as a whole. It's also an economic decision to address inequities in healthcare, right? And so, looking at some of the solutions and what those look like and how they can impact people is one, increasing access to telehealth services. Increased access to telehealth gives individuals who may not have proximity to healthcare systems and healthcare access to be able to give them that access through virtual means. We know that there are less resources in rural communities in comparison to the urban cities. And so telehealth has allowed an expansion and a wider reach of individuals who may live in more rural communities so they don't have to be driving 1 hour to 2 hours to be able to see a doctor and taking so much time out of their day, but still being able to get the services that they need through a virtual platform. There's also the consideration of using mobile clinics, going to where the people are, going to them, showing up. And mobile clinics can look like the buses or the vans that takes providers into communities that have limited access. Take providers into rural areas so they don't have to worry about the transportation to get to where they need to go to. It allows for people to be able to say, oh, look, this comes on this day. So I can go, I can get my checkup, I can speak to a professional, I can get the treatment that I need, and allows so much better access for so many individuals. And if you've ever had the opportunity to go on one of the mobile clinic vans or buses, they're so well equipped with so many screening tools, with so many medical equipment that they really can really just look at things. And the mobile clinics do have schedules of where they will go. And then for some individuals, the mobile clinic may be a spontaneous pop up, but it still widens the reach in so many ways. There's student run clinics, and we know that there are universities that are teaching individuals how to provide clinical and medical care to so many individuals. And so, using those student run clinics for people to be able to access care, oftentimes at a way lower rate as well, when they're using these trainees to get the care that they need. And so, whether that looks like student run clinics offering dental care, student run clinics offering eye exams, just primary care exams and services, or even mental health needs. And having these student run clinics who are being supervised by, trained and experienced providers and clinicians, but using this as a means for more access and also addressing the shortage in the field of professionals. Because now you have this pool of individuals that have been educated and trained in these areas, being able to provide help under the supervision of more experienced providers, as well as giving individuals with financial constraints the access to be able to afford the type of help and services that they need. And then there's the concept of co-clinics. And co-clinics operate as places that are not working in silo from each other, but have a wide range of services all in one area for people to be able to access. And so they can go to this one area and they can access the primary care doctor, but also access the specialist and also access a mental health clinician all at the same time. And so instead of trying to find transportation or time to be able to go that place and that place and that place, when it's all operating under one roof, it gives people more reach and more access to the care that they need without having to wonder how they're going to get there. And so these are some of the solutions to really addressing the barriers that can keep people and prevent people from getting the right and appropriate help that they need. So I do want to stop to see if there's any questions. Okay.
Yes, I do telehealth as a professional, and I have so many clients in rural areas that are LGBTQAI that wouldn't be able to find a therapist in the area that serves people with their identity. So I'm glad you brought that up. That was validating.
I absolutely love that you do that, especially when they're living in communities where they potentially feel thwarted belongingness or they feel ostracized or excluded from the whole. And so being able to access a provider like you through telehealth services allows them to bridge connection to something that at least will keep them in a mindset of actually wanting to be here. So I'm grateful to hear. It is one of the things that I really do have to credit the pandemic for allowing us to expand, because when we were in quarantine, the expansion of telehealth services for primary care, for urgent care, as well as for mental health needs definitely increased a lot of access. And I really do hope that this is something that we continue. And most insurance companies have like telehealth access through their insurance policies. A lot of jobs offer telehealth access as well. And then there are, organizations as well as private clinicians that provide telehealth services. And it's something that I hope we don't fall back on because of how it has really allowed individuals to be able to tap into the resources um, that they may not have had in proximity to the built environments and neighborhoods or towns or communities that they live in. So thank you for sharing that. I do appreciate hearing that it's been beneficial for your clients' needs. Anything else?
No,
So, in tackling mistrust and bias, that came up earlier. And so I just wanted to break down a little bit further how we can really make sure that we are tackling that mistrust, addressing our personal or systemic biases, and really being able to be what the patients and clients need um, in a really relevant and appropriate way. So first, trusting patients, not making assumptions about them, but really taking the time to listen, to hear what they're telling us, to try to understand things from their perspective as best as we can. Really paying attention to the complaints that they have about their different issues, their different healthcare relevant circumstances, and being able to be mindful that my perspective may be different from theirs, but their perspective is still their own and it's still valid. Trying to enhance our cultural competence skills or sensitivity to working with different populations, really looking at what does my environment and workforce look like when individuals are coming in, and is everybody able to really provide that cultural awareness and sensitivity that clients and patients may need. And then building trust. This is an explicit part of any type of provider patient clients relationship, right? Without trust in the provider patient relationship, you are not going to make much progress in treatments. Because if they don't know why they should listen to you, or they don't feel that they should listen to you, they really aren't going to do the follow ups that you recommend to the best of their ability. And so, how can we build trust? How can we make sure that we are building connection with the individuals that we're working with? And part of that is prioritizing that relationship building so that we can really better understand the person, so we can know the perspectives that they're coming in with us to us, and we can really then guide them towards what our recommendations are in ways that are going to be to their best benefit. And then try not to challenge core beliefs that people may have. I may not agree with you, I may not see eye to eye with you, but it might not be the right space and time to try to challenge those thoughts and feelings unless it is absolutely necessary for the type of treatment they are receiving. And then part of that also falls into not trying to overwhelm people with too much information that is oftentimes they're unable to comprehend. I like to stop and, very similar to how I teach, stop and go, hey, do you have any questions for me? Is there anything you want me to clarify? Is there anything you want me to explain? Because so many times the patients, when we're just talking at them and not talking with them, are just sitting there taking in all this information and they're leaving. And when they get home, a family member was like, so what did the doctor tell you? And they're like, I don't know. I don't really, they really didn't retain it because nobody took the time to help them understand it. And then meeting the patients where they are. You know what? Some people aren't at the point where they're ready to do the recommended treatment yet. And so it is taking a step back and pausing and trying to get them to get to that point instead of forcing them into making a decision right then and right now. There may be things that, listen, we need to act on this immediately, or it will result in a crisis. But sometimes it's taking it a little bit slower with them so that they can fully understand why these recommendations are necessary, rather than pressuring them and meeting them where they are to be able, it goes along with prioritizing the relationship and building that trust. And then considering the culture within the organization or team that you're working with. Um, is my team, is my organization reflective of the population that we're serving? Is my organization able to provide language literacy or translation services as needed when individuals are coming in that may not fully be able to speak or understand the language? Is my organization being understanding of people that are coming to us with different backgrounds and different lifestyles and different experiences? And then, most important, and this is something that I definitely push when I'm teaching any provider in the field, is making sure that we're preventing and mitigating the burnout that we feel. Burnout is not a badge of honor. Burnout is not something to be proud of. And so many times, especially with staff shortages and the influx of patients and clients, we're doing, and we're going. But we cannot help them if we are pushing ourselves to a limit where we then end up in distress ourselves, whether that's medical distress or mental health distress. It is so important that we are taking the time out to really pause and make sure that we're taking care of our own selves in order to provide better care. Because we all know those individuals who have been doing this for so long and so intensely that they start becoming jaded. And when you start becoming jaded in a field where you're providing care to people, you are not providing proper care or adequate care or compassionate care. And so making sure that we are really taking a step back and evaluating and being self-reflective of where am I? How is my body feeling? What's my mental health looking like? And is that impacting the type of care and services that I'm able to provide? And so these are just some steps. In no shape or form are they all of the things that we could do, but definitely some strategies to look at to really address that mistrust, that bias, and building better patient provider relationships. And then looking at how we can make sure that we are overall just impacting individuals in ways that is able to provide them with positive mental health. Because we know that our mental health impacts our physical health and vice versa. And so, how are we making sure that we're not just looking at our medical well being, we're not just looking at our chronic health conditions, but we're looking at the overall whole? Because our mental health impacts our brain. Our brain controls every single part of us. And our bodies are not going to be able to function right if our brain isn't functioning right. And so, we want to promote self mental health. We want to promote happiness and life satisfaction, psychological well being, as well as social well being. And this looks at different levels in so many ways, looking at it from an individual one on one perspective. What can the individuals do to make sure that they're taking care of their own health, their own well being, and they're living just like self satisfied lives? What does the family relationships look like? What is the health status of family on a whole? What is the household composition? What are the healthy habits and routines that are being promoted that are going to trickle down from the parents and caretakers and guardians down to the children to help promote positive behaviors for their futures as well? What does the community aspect look like? Is there community involvement? Are there social networks and social support that they're able to really build upon? And are they living in communities that are going to be promoting better well being for them overall? And then just even looking at societal factors. And is our society reflective of a positive mental and overall well being for the individuals that are living in it? And so, if we can better promote positive mental health, we can look at it as one of the precursor for building overall health in so many different ways. And then this is some of the research that I've used for today's material. And before we wrap up, I always do like to ask if there's any more questions or comments or experiences that anyone would like to share.
One question that's come up, like for patients like you who dealt with bias and your health suffered because of that, some patients might not know how to advocate for themselves. They might just feel that they might get all that resistance and then get very discouraged and then be gaslit to believe that nothing's wrong with them even though they are very sick. So what kinds of tips would you give patients to advocate for themselves?
I love that question. And I will say for my own self, this happened when I was pretty young. I was still in my early 20s. I did not feel empowered to advocate for myself. I went through four doctors who all made me feel like I was, in one doctor's word, making things up in my head and being super dramatic. And he literally told me that. And that was a hard thing to feel because it also made me not want to go get care. It made me not want to go get services. And the more I stayed away from the healthcare system, the worse my health got until it got to a point where it was almost detrimental. And so now in this life, having gone through that, I do try my best to empower individuals to know that one, you can question the doctors, especially for individuals that come from cultures or communities where they're taught not to question authority figures. And like a doctor or a clinician or a provider is in essence an authority, a major authority figure, and they've been taught like, no, you don't talk back, you don't question, you just take whatever they say as fact. And I tell people all the time, I was like, absolutely not. You can question them. You can also change doctors. Yes, I know that some insurances require that we list a primary care. I'll use an example, like my kid's insurance needed me to list a primary care doctor. I went to him several times. Every time I had a question, he spoke to me in a way that was like, pat, pat, pat on your head, little lady. Yeah, you're thinking too hard. And I was like, this is my children's health. What do you mean? And it got to a point where I would even bring my husband with me and he would speak only to my husband, and completely like ignore any questions that I had. And it got to a point where I was like, I cannot keep bringing my children to somebody that has made me feel so demeaned and belittled and misunderstood. So I called the insurance company and I was like, I need to change primary care doctor. And they were like, they asked, they're like, well, why? And I was like, it's just not working for me. This is not working for me because at the end of the day, it's my health, it's my life. Nobody else is an expert in my life but me. And so I have, since those two experiences, definitely told people, I was like, listen, don't keep going back to the same place if it does not work for you, if they make you feel a certain way. If you have access or ability to go somewhere else, go somewhere else. If you need to change, even with therapists, I've told people straight up, I was like, some therapists suck. Change them. Don't keep going back to somebody that doesn't make you feel better about yourself in any way. And so it is my hope that like we continue to empower people. I think from a provider perspective, I try to ask people to let me know what questions they have. Let me know what I'm not doing that they need more of. Let me know if there's any way that I can better support their needs, right? And of course, some people will be like, "No, I'm good," and I'm like, "Are you sure?" But I want people to feel as if they have a safe and brave space to be able to ask those questions, provide feedback, or get the clarification that they better need.
Thank you. Another question that just came through: as a patient and advocate, how do I make a point that I am stressed but unsure if symptoms are perimenopause or just life without a stomach? It's exhausting and I try my best not to gaslight myself, but I want to be proactive.
Oh, that's a really good question. Here's the thing, right? I say check, get it checked first, right? If and I speak as somebody who I gaslight myself all the time. I'm like, girl, it's not that bad. But what if it is? What if it is? And I've been trying to minimize my own issues to avoid the end results, right? And so my thought process would be, and my recommendation would be, if there are things that you are worried about, and you're worried about it from a medical perspective, or it impacting your well-being in any way, take the steps that you can take to get it checked out as best. And here's the thing: if the results come back and everything is good, then at least you made the effort to make sure. Another thing that I always recommend, especially to individuals with chronic medical conditions or who have gone through such major diagnoses, such as stomach cancer, I recommend mental health services. Finding a person that you can talk to and share those thoughts with in a safe space allows you to get everything that's in here out, because there's so many things that we keep percolating and we ruminate on them, and that builds up and builds up. It builds up our feelings of anxiety, it builds up our feelings of depression. And if I've gotten it checked out and everything is good, how can I still find a way to really relieve myself of the stress that I'm feeling as it relates to my circumstances? And so I do recommend that people with chronic health conditions do find a therapist to speak to, because it can help you to process. It can help you to develop better coping skills and techniques to deal with your life stressors. It can help you to build up your distress tolerance, or it can just be somebody that you get to vent to. And if you aren't at the space yet where you are like, okay, I'll speak to a professional therapist, just making sure that you have a positive support system that is there to listen to you, validate you, and support you as best as they can.
Thank you. And for another question for patients who were misdiagnosed because of bias or had delayed diagnoses because of their gender, how can patients make these doctors accountable for misdiagnosing them to the point where their health is harmed?
I'm gonna be honest with you. I don't know. I don't know the answer to that one. I went through four male doctors who minimized and misdiagnosed my medical issue for such a long period of time that by the time I got older, it had conflated to much worse. By the time I did go back, I did find that female doctor that was able to do the proper testing. It was a sense of relief, but it was also a sense of I never want anybody to go through this. There has been, however, one time in my life where it was a I'm gonna be real with you. I'll be honest and fully transparent. This was during the height of COVID during the pandemic, and there was a telehealth situation that I had with a doctor who recommended some treatment modalities that were very controversial, very much like very you need to inject yourself with bleach. And this was from like a medical professional. And I have gone through these experiences before that were so significantly impactful that at that point I was like, oh no, I'm not taking that. I reported him to his medical board. I reported him to the medical board, and I reported him. This doctor was through the telehealth service through my insurance policy. At the time, I also reported him to the insurance company. I was like, there's a doctor that is on your telehealth platform that gave me this type of recommendation for a severe epidemic. Um, and I did that because I was like, how many other people who may not feel as empowered or may not be as knowledgeable about healthcare systems are taking his recommendations to heart? And so, if you have the strength, I will tell you from two different perspectives. From my younger days and my less empowered perspective, I made a personal choice of not going back to those providers and finding a provider that best fit my personal needs and that listened and that cared. From an older perspective and a more empowered, and I was just in shock. I took steps that I felt were necessary to make sure this person was reported, and it prompted an investigation for this doctor. They did call me back to let me know that the investigation was ongoing and there were some other things that had come to light for it. And so I will say this from somebody who has done it in different ways: do what works best for you. Not everybody wants to go through the full process of reporting and following through, and it's exhausting. And I completely get that too. But if you feel like, you know what, no, this is important for me to follow long term, do what best works for you and meets your needs, because it's important that you are getting the best health care for your own well-being, but also feeling that you know your needs were met and your needs were met appropriately.
Thank you very much for that. So otherwise you got comments. Thank you so much. This was so informative and refreshing. And thank you for your caring and concern. You are a blessing. And how can providers be more like you? You are so kind and thoughtful, and everyone's been very thankful for this presentation.
Ah, thank you. I hope I continue to hope that there are good providers in the field, medical, mental health, specialist wise, because when people are going through the hardships that they encounter, I want people to get the best help that they can. But thank you so much.
Yeah. Yeah, thank you. I just have a few more slides to share, but Aisha, really thank you so much for this presentation. This was very helpful and very empowering, and a lot of people are gonna like really be able to take this to heart and get better healthcare thanks to this. And I hope providers who listen to this are better doctors because of this. So thank you. So just for quickly, these are some of our upcoming events and programs. And for more information on this, you can go to our website at www.wstream.org. And then I'd like to thank our sponsors again for making this possible. And to view any of our recorded webinars, visit our lecture library. This webinar will probably get on our lecture library within the next week or two. But this concludes today's presentation. Really thank you everyone for tuning in, and really thank you again to Aisha for your time, for everything that you do for Debbie Stream Foundation. Have a good day, everyone.
Hi, everybody.